Hello, everyone. It's a pleasure to be able to participate virtually in this session. I'm going to focus on men and children. For men, I'm going to look at male feminization, and for children, puberty onset. For both topics, I'm going to present information about the origins of the concern, and I'll also look at reproductive hormones in men and children. And then for men, I'll focus on sperm and semen and gynecomastia, and for children, I'll look at Menses onset and pubic hair development. There have been several publications that have raised concern about male feminization. Of the three I'm going to show you, the first is a case report published in 2008, which described a 60-year-old man who developed gynecomastia related to his ingestion of soy products. However, often overlooked is that this individual was consuming an estimated 360 milligrams of isoflavones per day. That's about 9 times typical Japanese intake. 3 years later, there was another case report. In this situation, it was describing a 19-year-old vegan who developed a loss of libido and erectile dysfunction after ingesting large quantities of soy. And coincidentally, this vegan was also ingesting 360 milligrams of isoflavones per day, about 9 times typical Japanese intake. And then the third publication is a case report, or excuse me, cross-sectional study that found higher intake of soy foods and soy isoflavones is associated with lower sperm concentration. This cross-sectional study involved 99 male partners as subfertile couples. And not surprisingly, because this was a US study, soy food intake was quite low. In fact, you could be in the 4th quartile intake if you consume less than 1/3 of a serving of soy per day. I don't actually think it's possible for 1/3 of a serving of soy to exert a biological effect. Nevertheless, the investigators found that soy intake was associated with lower sperm concentration. However, I want to emphasize that there was actually no effect on sperm count, and that's because much of the decrease in sperm concentration was because soy intake was associated with an increased ejaculate volume. And because there's no biological plausible explanation for soy increasing ejaculate volume, I question these findings overall. And in fact, 7 years later, the same team of investigators found soy food intake was unrelated to clinical outcomes among couples presenting at an infertility clinic. Of course, if we're going to make any meaningful conclusions, we need to look at the clinical trial data. 3 intervention studies have evaluated the effects of soy and isoflavones on sperm and semen parameters. None of these studies have found any adverse effects. They ranged in duration from 2 to 3 months, and the dose ranged from a typical dietary dose of about 40 milligrams per day to a high of 480 milligrams per day. That's the equivalent of about 20 servings of soy foods, and yet you still see there were no adverse effects on sperm or semen. What about gynecomastia? I just mentioned there was a case report of a 60-year-old man who developed gynecomastia in response to his soy intake. 2 studies have evaluated gynecomastia. Neither one has shown any adverse effects. Due to time constraints, I'm just going to focus my attention on this study. It was the longest and largest. You can see it involved almost 300 men. It was a 3-year study, so quite long by nutrition standards. And the men consumed 100 milligrams of isoflavones per day or a placebo. 100 milligrams is at the very high end of the dietary range. And there was absolutely no evidence of gynecomastia. And then finally, and I think most importantly, the question is whether soy or isoflavones lower testosterone levels or raise estrogen levels in men. And it's important to look at both hormones, not just testosterone, because circulating levels of estrogen in older men are actually higher than they are in older women. And here we see the results of this updated and expanded meta-analysis. It found regardless of dose and study duration, neither soy protein nor isoflavone exposure affects hormone levels in men. And this was a pretty large database. You can see there are about 41 clinical studies in total. And you see total testosterone, free testosterone, estradiol, and estrone were all examined as well as sex hormone binding globulin levels. No evidence of any effects on hormone levels. So I think it's reasonable to conclude that even when exceeding typical Japanese intake, neither soy foods nor isoflavones cause male feminization. I think the data are pretty clear on that point. Now let's take a look at children and specifically focus in on puberty onset. One of the reasons there's been a concern about this issue is because studies worldwide have observed secular trends towards earlier puberty development. And this is most evident in girls. And you can see this when you look at the change in age of Menses onset over the past several decades in many different countries. So for example, Menses onset went from 13.8 years to 12.6 years in Japan, and it went from 13.5 years to 12.3 years in the UK. But this change was occurring in countries that consume soy as well as countries that don't consume soy. Now, there's less evidence that earlier puberty is occurring in boys, but here's a Swedish study that did found a trend toward earlier age at which peak height velocity occurs. So it's occurring in both girls and boys. And this topic is of interest to those focused on soy because one school of thought is that earlier puberty development may be due to exposure to hormonally active chemicals in the environment. And because soy is classified, or isoflavones are classified as phytoestrogens, there's been interest in the relationship between soy and puberty. It's also of interest because children may absorb isoflavones to a greater extent than do adults. Now, 2 studies have evaluated the effects of isoflavones on hormone levels in children. Both are very small studies. This first one is an open label study involving 17 girls, average age about 11. They consumed for 8 weeks 27 milligrams of isoflavones per day, and then the investigators looked at urinary sex hormone levels. And here are the hormones that were examined, and there were no effects of isoflavones on any of the hormones. But there's a large variation in hormone levels among girls at this age. And so you really would have needed a much larger study to see statistically significant effects. And that's what the investigators concluded, given the small number of girls in this pilot study and the large variation in urinary measurements, our results need to be validated in a much larger population exposed to soy foods over a longer time. So were there no effects, but it was a small study. And that's the case with this 2010 study that found neither low nor high dose isoflavone consumption over 8 weeks induced any hormonal changes. This was an even smaller study, 8 girls, 4 boys, age range 5 to 11, crossover design, 8 weeks per treatment, 2-week washout period. In this case, you have placebo 16 or 48 milligrams per day of isoflavones. You look at the hormones, estradiol, testosterone, sex hormone binding globulin, LH, and FSH. No effects of isoflavones on any of the hormones, but you can see the large standard deviation. So these studies are really too small to reach meaningful conclusions. Next, let's look at studies that examine the effect of isoflavones in soy on puberty onset. Several studies have done that. I'm just going to focus on 2. Both were conducted by Loma Linda University researchers involving Seventh-day Adventists. About 40% of the Adventists are vegetarian, so their soy intake is much higher than the average person in the United States. And this study found that soy intake is not associated with the age of Menses onset in a population of adolescent girls who have a wide range of and relatively higher soy intake than the general US population. So this was a cross-sectional study involving 327 girls. The girls ranged in age from 12 to 18. A food frequency questionnaire was used to assess current intake, and then the current intake was used as a surrogate for past intake. And you can see on the left a really wide range of soy intake. Low intake was no more than 1 serving per week. High intake was more than 3 servings per day. No relationship between soy and age of Menses onset. Now, 4 years later, the same investigators published a study in Seventh-day Adventist boys, and they found that the age of puberty in these boys occurs well within the range for US boys, but they also found that high and moderate isoflavone consumers tended to have puberty a little bit earlier than the low consumers. So let's look at the data. Similar design study, cross-sectional 248 boys, Again, a food frequency questionnaire was used to assess current intake, and that was used as a surrogate for past intake. Then you can see that when looking at pubic hair, it was pubic hair Tanner stage 2, that was the measure to assess puberty onset. Puberty onset did occur a little bit earlier in life in the high isoflavone consumers versus the low isoflavone consumers, and that finding was statistically significant. But it was a very small difference nonetheless. And when they looked at facial hair, which was a secondary outcome, there was no difference according to isoflavone intake. I think it's also worthwhile pointing out that although the high isoflavone consuming boys did have puberty a little bit earlier than the low consuming boys, even for the high isoflavone consuming boys, their puberty onset was later than it is for the average boy in the United States. As you can see here, for white boys, for example, it's about 11.5 years. So I would conclude from looking at all the evidence that there is, based on the live-in evidence, I think it doesn't suggest that isoflavones are causing hormonal imbalance in children. But again, the evidence is very limited. And I think we definitely need more research. I think a proposed study could be to look at the impact of soy on the testosterone surge as boys enter puberty. And I want to thank you for your attention.